Good morning, guys. Welcome to today's presentation. In today's presentation, we are going to look at breast cancer, radical mastectomy, postoperative care, and how to prevent breast cancer. So this is a past paper question. So today we are going to review a past paper question under surgery. So if you're seeing this presentation for the first time, and if you've not subscribed, make sure you subscribe to this channel, like and share. So let's get started. So the question said, Mrs. Mulenga, a 45-year-old teacher by profession, has been admitted to a surgical ward in preparation for her radical mastectomy operation. So your part is to define. So A, define radical mastectomy, define depression. B, explain the grieving process. C, explain the post-operative management you give to Mrs. Mulenga. Then D, state the 5 points on how to prevent breast cancer. So we start with the definitions. So radical mastectomy, this is a complete removal of the breast, the nipple, some underlying skin, pectoral muscles. These are major and specific muscles. They are adjacent fat and fossa and the axillary nodes. So notice that radical mastectomy is the removal of the breast, and this is a cancerous breast. So for the treatment of breast cancer, when it comes to surgery, there are different types of breast removal or mastectomy, and one of the major surgeries that is done is radical mastectomy, and this is what we are defining. We said it is the complete removal of the entire breast, so all the parts of the breast are removed. So the second part of the question was saying define depression. So depression is an emotional state manifested by a person being sad, discouraged. So the person is depressed, and at times they are unable to act for oneself. So it is emotional state manifested by sadness, discouragement, self-depression, and at times inability to act for oneself. So remember that when a woman has breast cancer and they are going to undergo an operation, they'll feel a sense of major loss because their image is going to change. So it is important as a nurse or as a health practitioner to help them during this process, and this is why we are learning this. So radical mastectomy, as we defined it, we said it is a complete removal of the entire breast, the nipple, the underlying skin, the muscles, and this is how it looks like. So this woman underwent both breast removal surgeries, and these are the scars, as you can see from the picture. So now the B part of the question was saying explain the grieving process. So what is the grieving process? So grief is a normal response to loss. It is an emotional response which helps people who are experiencing a loss. So especially when it comes to patients who have cancer and have to undergo operations, because it's a major loss of a part of the body, they will undergo a grieving process. Not only people that are going through um, um, cancer issues, but also even in our personal lives when we are experiencing some loss, for us to reach at a stage where we accept what we are going through, we do undergo the grieving process. So let's now look at the stages of the grieving process. So the grieving process has 5 stages, and the first stage is the denial stage. So during the denial stage, at this stage, the person thinks that this is not happening to me. They are non-acceptance. At this stage, the person is ready to learn about care, is not ready to learn about care or the treatment options, um, or receiving counseling. So the patient may go from one place to another looking for a different diagnosis, especially for cancer patients or patients who have got AIDS. So when it comes to the denial stage, this is where a person is given a diagnosis. For example, a client works in the hospital who has certain symptoms, and then after investigations, they are told that you have breast cancer. In this case, we're talking about breast cancer. So when a woman is just told that you have breast cancer, for them to just accept that this is happening to me, I have breast cancer, then I have to go an operation. So before all that will take a process known as a grieving process. Now, the first stage of the grieving process is denial. So a person will deny to say, no, I can't have breast cancer. It cannot happen to me. So at this stage, the person is not accepting the situation, and they are not even ready to learn about the treatment and the counseling. So the next stage is hunger and rage. So after they deny that this is not happening to me, um, we moves on to stage 2, which is rage or hunger. So at this stage, the patient or his family members may appear to be angry at the hospital staff or friends. In reality, the patient is angry that this has happened to me but has to take it on someone. So this is a normal reaction to an unexpected loss, and it will pass. So the nurses and other health professionals should stay calm and not react or argue, as this may cause conflict. So the patient may ask himself or herself, why me, especially cancer patients, because they face significant loss as self-esteem, privacy, and perhaps they may also lose their own life. So when it comes to the anger stage, this person becomes angry at themselves. They become angry. So the becoming of angry means they are getting to accept that this thing has happened to me, but they have to take it on someone. So this patient or the family member may appear angry at the hospital staff. So it is in such situations that we as nurses and other health professionals who are handling these clients and families, we have to learn to keep calm so that we help them accordingly. So then there's the bargaining stage. Under bargaining stage, the person may seek to bargain for or make an agreement or deal for a different outcome. For example, a patient that's accepted that, okay, this thing has happened to me, but uh, can I do something to prevent it? Which is too late because the result has already come out. Maybe if there was smoking or there were too much involved in sexual activities with multiple sexual partners, and then they've gotten the HIV. So they want to think, okay, then I'm going to stop having multiple sexual partners just to prevent AIDS. But at that point, it is already too late. So that's the bargaining stage. Then we have the depression stage. So the person says, this has happened to me, so what's the purpose of me? What's the purpose of my life? So this is a dangerous stage, because a person can even take their own lives because they feel useless. They feel there's nothing they can do about the situation. So the person adjusts his or her mental state and loss of hope. They may be sad and others may be quiet. People may react differently. Others may talk freely, others may withdraw and not talk to the nurse or the health profession. So the last stage is the acceptance stage. So the person gradually comes to terms with a changed body image or um, changed life circumstance. So the patient may feel as this is the final rest before a long journey. So in this case, we are talking about breast cancer, and when the breast is removed, it is a major, it's a big different to a woman, because they are going to look differently, and even the yeah, a lot of things are going to change. So it is a long journey for them. So the next question was saying, now explain the post-operative care for a woman who has undergone a radical mastectomy, which is a major operation. Now let's look at the management. So the aim of the post-operative management for a patient who has gone radical mastectomy is that we want to promote quick recovery, prevent post-operative complications, and to enhance emotional adaptation. We want to make sure that the patient accepts their situation and they adapt to the new self. So notice that this is a specific management. I'm sure we are very much familiar with the general aspect. So in this presentation, because of time, we're just going to look at the specific points. So when it comes to the immediate care, on under position. So this patient has just come from theater. How are we going to nurse them? So we'll put them in the lateral position on the unaffected area. So if the breast has been removed on the left side, we are going to put them in the right lateral position. So when the patient recovers from anesthesia, she is usually comfortable lying on her back with the head elevated. So then, if the unaffected arm is not incorporated in the dressing, the arm is elevated to enhance circulation and the arm above the level of the light atrium. So all this is under position. So to turn to the opposite side and sit up, if she would be taught to push up the elbow of the unaffected side rather than pull up. So we want to make sure that the pressure is not pressed on the affected side. So the patient should always be lying on an affected side. And then when it comes to observations, the vital signs are going to be observed every after 30 minutes. So yeah, so under observations, we are going to make sure that we observe the dressing. Observe the dressing often for the first few hours to detect hemorrhage or excessive oozing. So we want to make sure that if the patient is bleeding excessively, the surgeon is informed quickly. Then we have to examine the bed cloths for blood that may flow down the incision site. Then also any evidence of bleeding should be reported to the surgeon, as we said earlier. So any signs of circulatory obstruction such as swelling and numbness of the lower limbs or inability to move the fingers must be reported. So monitor vital signs accordingly in the initial phase and in the subsequent stage. So No blood pressure reading or injections or blood testing should be done on the affected arm because of potential or full circulatory impairment. So the arm where the breast has been removed should just be kept freely. No injections to be done on that side, no blood collection, no anything. So this is because we want to prevent any potential circulatory impairment and infection. So when it comes to wound care, so the patient comes to the ward from theatre with a drain catheter inserted under the skin. So this is the drain. So the purpose is to remove blood and serum that may collect under the flip that would prevent healing and predispose the woman to the infection. So the drain, this is the drain, and its purpose is to remove any blood or serum which may collect under where the operation has been done, and this can, if not removed, it can cause infection and some complications. So the drain from the wound site may be removed 24 to 48 hours post-surgery. So this drain is instead inserted in the axillary. So the drains inserted into the axillary wound can stay in for a few days or until the fluids are reduced significantly, usually 3 to 5 days, or when the amount of drain is less than 5 to 10 mils in 24 hours. So this is under wound care. So also we want to make sure that the dressing should be light and non-occlusive and pressed only if swelled. So then also the dressing may be removed in 24 hours or may be changed after several days after surgery. So the skin sutures are also often removed on the 6th to 8th day post-operatively. So when it comes to wound care, if the graft has been taken from the thigh or back, this area may be covered with some form of pressure or fine mesh gauze, or the wound can be exposed to air. So this is what we are talking about. When the breast is removed, a skin graft can be done. So it can be done on the thigh, on the abdomen, or on the back. So this is how it looks like. The skin graft has been done there. So this area may be dressed with some form of pressure. This is what this point is talking about. So let's move on to pain management or pain relief. So when it comes to a patient who has undergone a major surgery such as a breast surgery, they may be in pain. So the role of the nurse is to make sure we assess the level of pain so that we manage accordingly. So pain assessment using the scale of 1 to 10 should be done, and 10 being the most worst pain. So strong analgesics such as pethidine will be administered as prescribed to relieve the patient from pain. So for mild to moderate pain, analgesics such as diclofenac and paracetamol can be given as prescribed by the surgeon or the doctor to relieve pain. Then teach the patient how to breathe deeply and how to cough. Then all nursing procedures to be done in block in order to give the patient enough time to rest. Then the nurse the patient in a quiet room by eliminating all sources of noise to promote rest. Now also handle the patient with care to avoid causing more pain. So if the wound is not covered with a dressing, a bed cradle can be used to protect from the bed cover and to lift the linen off the wound to prevent pain. So notice that as you are writing, if you are writing in an exam, you have to write uh, it accordingly, not the way it is represented here. So you have to state nicely, I will handle the patient with care to avoid causing more pain. So I could use a bed cladle to lift off the linen from the wound to prevent pain. So that's how you're going to be stating it if you're writing an exam. So when it comes to nutrition, during the initial postoperative days, which is the first or the second, to the second day, the patient will have little interest in food. Therefore, we have to administer intravenous fluids such as dextrose to provide energy and correct dehydration. As we can see, the patient is receiving half fluids. Then when it comes to meals, when the patient starts eating, meals should be served in an attractive way to promote appetite. Then also provide a balanced diet for successful therapeutic outcome and wound healing. Then also give patients their favorite meals or food to promote food intake. So when it comes to activity and exercise, which are very much important to the patient who has undergone a mastectomy, what is called a squeezing a rubber ball is often started on the first day of the operation. So this is how it looks like. So here the woman is squeezing this this ball as it's illustrated here. She should be encouraged to promote this will help to promote in this pinter her forearm simply by turning up the palm and down. Okay, so this point is at its own. So the woman should be encouraged to knit her forearm simply by turning the palm up and down. So on the affected side, the woman should be making movements up and down of the palm, of the affected palm. Then exercises are very essential to prevent shortening of muscles, stiffening and contractures of the shoulder girdle, and to preserve muscle tone so that the affected arm can be used without limitations. So gentle exercises are started early post-operatively. This helps to decrease muscle tension as well as regain muscle function more quickly. Then the patient is encouraged to flex and extend the arm immediately on return to her room. So this is after operation. So this stitching is done, this point will be done before the patient goes for the operation, which is pre-operative care. So when it comes to psychological care, it is very much important that as a nurse we take care of the psychological needs of this patient. Why? This is because loss of a breast involves a major uh, concept, which is one change in body image and mourning over a loss. Remember, we looked at the grieving process. So the initial response is usually shock. So the woman is shocked because of what she is going through. The patient will need support during this difficult time. So phantom symptoms of a missing breast may occur in women with painful breast or nipples before surgery. So you know that phantom pain is that pain which a patient feels after they have removed a certain part from them. So the patient will feel like the breast is there still there and it's paining while it has been removed. So if the incision site is too large, postponing looking at the incision delays the impact that the breast has indeed gone. So if the incision site is too large, we will delay telling the patient to look at how the breast is looking because of the psychological effect. So it is important, therefore, to prepare her in advance concerning the size of the incision. This is very helpful, but still, she needs considerable support when reviewing the incision and her new image. So this is when so preoperatively the patient should be told that the entire breast is going to be removed and the incision site is going to be quite large. So the patient should be prepared psychologically before the operation. Then even after the operation, the patient should be reassured of what has happened, that the breast has gone and the incision site is quite big, so that they accept the situation. So also brushing the teeth and hair are encouraged later, but as soon as they are tolerated. So under close supervision is encouraged to exercise each day more and more to limit incision or pulling and discomfort. So these exercises should be done under supervision. So the nurse should be there to help the patient do these exercises, or other health professionals such as the physiotherapy can be involved in this. So with full range exercises of motion will retain, and that is both on the arms to be extended equally above the head. So it is very much common that the patient will still have feelings of anger and resentment even after the operation. So after the patient is discharged, she may experience periods of depression, and if she perceives her recovery to be slow, if she tries to perform her previous activities. So after the patient is discharged, they may still be feeling depressed and they may have difficulties to perform their previous activities. So the patient should be prepared for this change in their lives. So when it comes to sexual adaptation, we know that our breasts are very much important for us women, and so if they are removed, so even our sexuality is affected in some way. So when it comes to sexual adaptation, women with a small or very large breast may have long-standing unresolved issues about the size of the breast and may have difficulties in obtaining satisfactory breast prosthesis. So, for couples who are unable to communicate their feelings openly with each other, counseling may be helpful for them so that they accept to live with the condition, which will turn to help them and to help boost the woman self-esteem. So the husband should be able to must be involved first of all in the psychological and sexual adaptation of this patient's management, and also counseling for them as a couple should be done, so that this will also help the woman to have a good self-esteem. So now, when it comes to breast implants after surgery, the patient should be taught accordingly. So breast prostheses are not fitted until at least after 6 weeks post-operatively, or after the incision is healed and no longer tender. So when the breast is removed, some who may afford to, or who may want to put breast implant it can be done after 6 weeks or after the incision has healed and there's no wound and it's not tender. So the patient should be educated on that one. So until the incision is well healed, the woman is advised to wear one of her own bras, which is lightly padded with a soft fitting or a temporarily soft prosthesis. Yeah, so a woman will still wear her bra, then protected with something there padded on the part of the breast which has been removed. Then using plain cotton can be covered with a gauze and lightly tucked inside the bra. So loose hanging gowns are usually acceptable. So a patient should wear something which is loose. So both gowns and robes have armholes to prevent constriction of the underarm. So the types of gowns that the patient is going to wear, they have armholes. This is for this reason. So when it comes to treating lipedema, so many patients develop a slight edema on the upper arm that disappears within a week. So a few patients, however, may develop some severe form of edema that persists and that may become permanent. So some surgeons order an elastic sleeve that gives an additional support to the vessels in the arm which is affected. And a diuretic such as a chlorothiazide may be ordered to help relieve edema. So special care must be taken to prevent minor infections of the hands and arms in patients with lymphedema. So then if the infection do occur, medical treatment should be sought at once. So we want to make sure that the treatment is done as quickly as possible. Then the axillum should be kept clean with soap and water. Then when it comes to, so that's the specific management, specific post-operative management. So make sure you take your time and go through it at a pace that you understand well. And combine the specific management with the general management so that you have a complete view in case it comes in the exams. So the last part of the question was to explain the points about prevention of cancer, which was the D part. So there are a lot of things that we can do as women to prevent cancer. So one of them is that because early onset of menarche is largely the result of rapid growth and weight gain of children related to the abundance of food and supplies. So early menarche means early development, early organ development in females, and this is especially with children who have abundance of food, who live so these they are predisposed to having breast cancer. So it means their diet has to be monitored. So at least at least 6 months of lactation for optimal infant health, and this reduces the risk of breast cancer. So when it comes to women that have got children, making sure that they are breastfeed the children up to 6 months can help reduce cancer. So also, because alcohol consumption increases breast cancer, this reducing alcohol consumption reduces the risk of cancer. So women should be educated that excessive alcohol can predispose them to breast cancer, so that they in control of that. So avoiding weight gain during adult by exercising regularly and restricting calorie intake, and counseling patients throughout adult life is important to control weight. So it means weight gain predisposes to breast cancer. Therefore, it is important for women to maintain good weight to prevent breast cancer. So also increase vegetable intake while reducing fat intake. Then also screening of elevated estrogen levels for postmenopausal women to help identify those women who would benefit from estrogen antagonistic drugs or treatments such as morphine citrate. So this therapy reduces the risk of both invasive and ductal carcinoma in women at risk of breast development. So it also reduces the range annual rate of invasive breast reoccurrence. So preventive mastectomy for women at high risk of developing cancer. So for women who think they are who are at high risk of breast cancer can resort to preventive mastectomy. Now these women who are seeking prophylactic mastectomy should be counseled in depth about the negative effects on quality of life, the complications in preventive surgery, and loss of normal breast function. Then avoid long-standing estrogen therapy. So patients should be educated on the risk and benefit of estrogen therapy in postmenopausal women. So this is where this presentation ends, and that's how the question ended. So this information can be used in our own lives as women on how to prevent breast cancer, and as health professionals how to manage patients with breast cancer, and how to help patients who are grieving. So thank you very much.